One in three Americans face so-called diaper need, the inability to provide an adequate supply of clean diapers for their child or children. According to U.S. Census data, nearly 20% of D.C. kids under the age of 5 were living in poverty in 2020. Welcome to Impact Moment, brought to you by DCTV. I'm Michelle McCrae. Parents who face diaper need often have to make the hard choice between paying their rent, paying for food, and paying for diapers. But thanks to the Greater DC Diaper Bank, 32,000 families every year have part of that weight lifted off their shoulders. Today, I'm joined by T'Pring Westbrook, part of the DC Diaper Bank's Board of Directors. Welcome, T'Pring.
Hello, thank you for having me.
Hello, and thank you for being here. Now, your nonprofit partners with over 75 social service agencies, healthcare providers, and other agencies to provide diapers and hygiene essentials. How are diapers the gateway to relationships between families and social service agencies?
If you've ever been around a little child, a little baby, or if anyone out there is listening who is a parent, then you know that for about 3 years, the need for diapers just runs your life. You need a diaper every time you leave the house, you need to have a diaper. If you're going to work, you need to have a diaper. If you want to take your child to daycare, they need diapers. So diapers are actually kind of this grease that oils the wheel of productivity when you have a child in diapers. But they're not supported through public assistance. They're very expensive, and they can be more expensive in communities of lower income, which is true of so many products. And so being able to provide those diapers for a parent helps alleviate a whole load of stress, alleviates a lot of expense, and it also alleviates, it supports the development of the child and supports the parent in doing, going to work and doing their other activities. And so once that is taking off their minds, then they're free to think about other things and to come into social services organizations or come to the doctor or do all those things because the shame is gone, the logistics have been worked out, and sometimes it's a money issue, and just having the money taken care of allows them freedom to do what they need to do, the parents, that is.
And I'm sure the parents really appreciate the stress relief. So in 2021, you distributed 9.5 million diapers to families in DC, Maryland, and Virginia. 98% of families last year said that receiving diapers reduced their stress levels as a caregiver. We were just talking about that. That stress couldn't have been higher than it's been during the pandemic. How did COVID affect your operations?
COVID was a challenge for us in the same way it was a challenge for a lot of people. We had to figure out the most efficient way to get the products to the families. Luckily, we already had existing partnerships, and we expanded some of those partnerships with food banks, for example, and with other service providers. We also, that 9.5 million, that's an increase because we had to be responsive to the demand, because as we all know, the pandemic created a lot of economic crises on top of existing economic crises. So we worked hard to increase our response to the demand.
I think it's a great concept. Now, one of your partners helps unhoused families in DC. A social worker found that a mom was able to get her child to daycare services 5 days a week because she could save the money on paying for diapers to pay for her bus fare. How common are stories like this, and how do they drive you to keep working?
I work in the kind of nonprofit anti-poverty space, and I know that a lot of the things that me and my colleagues are trying to do in response to what families are asking for in order to get themselves to a place of stability and economic sustainability, they are hindered when these basic needs, because the diaper bank doesn't just do diapers, they also do other basic needs. when your basic needs are hindered, it is hard to find the bandwidth to do anything else, for thinking long-term, because you have this child who maybe doesn't have a diaper, maybe you're rationing diapers. Again, if you have any experience with babies, rationing diapers and runs into diaper rash, which runs into a miserable household because you've got a baby that's just so uncomfortable and they don't know why, and they're just keeping everyone up and agitated. So it's just diapers, but the connections are extensive.
Exactly. Well, T'Pring, we thank you for meeting the basic needs of families in the community, and thank you so much for joining us today. And to our viewers, thank you for tuning in to this episode of Impact Moment. It's part of DCTV's nonprofit capacity building grant program, our original programming to highlight the ways our area nonprofits are making a difference. Stay up to date with our latest productions and tune in to our live stream at dctv.org.